Well, welcome everyone. We're thrilled to have you all here for a very special event. I'm Robert Klinsmann. I direct the Masters of Bioethics program at Columbia, where I'm a professor in the medical school and the School of Public Health. And this is our second inaugural event that we're having here in San Francisco. Columbia, as many of you may know, has set up a space here since the largest number of Columbia alum outside New York are in the Bay Area. And we're thrilled that they selected bioethics as one of the 4 areas to focus on here. This evening we have all of you here with us, and we also have about 100 people who are watching this via live stream. And people who are watching it via live stream, please feel free to email questions at any point, and during the Q&A we will be answering your questions as well as the questions of people here in the room. So we encourage you to be part of the discussion.
Put it in the chat.
So put the questions in the chat that's on the bottom.
On the bottom row,
on the bottom row, there's a chat, and just put your questions there. And Samir Lada, who's our associate director, will be monitoring that and asking questions, raising the questions. We're thrilled to have with us this evening as a speaker Thomas Nesbitt. He is the associate, or has been the Associate Vice Chancellor for Strategic Technologies and Alliances at University of California at Davis. He has been done extraordinary things over his career. Our paths crossed in some way in the past. You were both Robert Wood Johnson Foundation clinical scholars, and he's one of the people whose names I have continued to see in major journals doing interesting work. He was the Interim Vice Chancellor for Human Health Services and the Dean of the School of Medicine at UC Davis at one point. He has, throughout his career, addressed issues in health services research, and particularly health disparities and ways of improving healthcare access and developing the healthcare workforce here in California, but also nationally and globally as well. He has focused on how to improve education and care in rural areas, and to do that has been one of the pioneers in the world in the use of telemedicine. He, in 1992, started UC Davis's first telehealth link, so in the last century, just to suggest how ahead of the curve he is. He established the California Telehealth Network. He's secured over $100 million in funding to help build that and other initiatives. He established the UC Davis's Center for Virtual Care. He's received numerous awards, including the Justin Ford Kimball Innovators Award from the American Hospital Association and the Leadership Award from the American Telemedicine Association. So telemedicine has been changing many of our lives and is going to revolutionize medicine in many, many ways. And we're thrilled to have one of the world's experts in it talking to us this evening. Please have questions at the end, and please join me in welcoming Dr. Nesbitt.
Thank you very much. So I want to say I'm really happy to be here, and I want you to fasten your seatbelts because you're going to get about a 4-hour course in 40 minutes. So the first thing I want to say is I don't have any conflicts. I didn't invest in any telemedicine stuff. Don't have any grants from companies or anything like that. So nothing that I discuss I have any financial or other interest in. What I'm going to do tonight is I'm going to talk to you a little bit about some of the rationale for telemedicine. I'm going to do a very brief on definition and a little history just so you can hear where telemedicine went. I'm going to talk about it in 4 settings. A lot of people hear telemedicine and they all have a different idea what it means. So I'm going to talk about sort of 4 versions of it, and then we'll summarize.